This InstaLecture number 92 is to tell you the difference among three terms which are commonly confused. One is rheumatic fever or acute rheumatic fever, rheumatic carditis, and rheumatic heart disease, RHD. These three are completely different terms and you must not confuse among them. So let's start to discuss one by one. Firstly, rheumatic fever or acute rheumatic fever. Acute rheumatic fever is a multisystemic immunologically mediated disorder which follows a group A streptococcal infection. So it's a sequel, it's a non-suppurative sequelae of the group A streptococcal infection. Itself is not an infection, but it's a you can say complication, non-suppurative complication of infection, which usually follows 10 days to weeks after a group A streptococcal infection. And its acute manifestation contain multisystemic involvement. It could be migratory polyarthritis, it could be subcutaneous nodule, it could be erythema marginatum, and also it involves carditis. Carditis means inflammation of the heart layers, including valvulitis. Valves are also inflamed in this. So particularly the acute phase of acute rheumatic fever, the cardiac involvement, that is the cardiac inflammation is there, that is termed by rheumatic carditis. So rheumatic carditis is one of the manifestation of multiple manifestations of multisystem manifestations of rheumatic fever. That is the point you need to understand. On the other side, when you use the term rheumatic heart disease, it's basically a sequel of rheumatic fever. Acute rheumatic fever, which usually seen 10 to 20 years after the acute rheumatic fever, or in between there could be multiple episodes of rheumatic fever. But when we are using the term rheumatic heart disease, some people use the term chronic rheumatic heart disease. That basically means that some amount of valvular damage has been done. There is some kind of fibrotic changes. Pathological changes is already seen in the valve. That means the leaflets are damaged. There is a difficulty in the motion of the leaflets. There could be fusion of the leaflets, could be fusion of the body. So these features, some kind of fibrotic changes due to chronic phases of inflammation, that means recurrent phases of rheumatic fever that has resulted in some permanent damage in the valve. Then only use the term rheumatic heart disease. Some people also call it chronic rheumatic heart disease. So chronic rheumatic heart disease is not same as acute rheumatic fever. Rather, chronic rheumatic heart disease is the most severe complication, long-standing complication of the acute rheumatic fever. And when we are using the term rheumatic carditis, we are basically meaning the acute inflammatory changes which are seen in the heart due to this multisystemic inflammatory disorder in the acute phase of the acute rheumatic fever. So these three are distinct terms: rheumatic fever, rheumatic carditis, and rheumatic heart disease, RHD, usually the terms. Now, some few basics which I would like to tell you also, that rheumatic fever is a immunologically mediated multisystemic disorder which follows a group A streptococcal infection. So what actually happens in this condition, that as a result of the infection, the body produces some antibody against the streptococcus cell wall. There are certain proteins like M proteins are there. And these antibodies which are produced, there is a phenomenon called molecular mimicry is there. They cross-react it with certain other body parts of the human body. That means these antibodies, they confuse certain parts of my body thinking that they are the streptococcus, group A streptococcus, because there is some structural similarity there between the streptococcal cell wall and the certain parts of our body like cardiac valves. So that confusion results in cross-reactivity, means these antibodies which are actually produced to destroy the streptococcus, they are now start to react against my own body, certain parts. So if it goes in the brain, they can cause certain changes, pathological changes in the basal ganglia, can cause Sydenham's chorea. That can cause carditis in the heart. Similarly, the acute rheumatic fever could also manifest with subcutaneous nodule, erythema marginatum, and migratory polyarthritis. So it's actually not directly the infection, rather it's a complication developing as the infection due to the production of these antibodies which are cross-reacting with certain parts of my body. And that's why this gap period is there. That means the infection, and there is usually 10 days to few weeks, this gap is there, then only the acute rheumatic fever develop. And because this immunological reaction will take some time to develop. So that is the reason this gap occurs. So in a nutshell, what we understood that acute rheumatic fever, when using the term rheumatic fever, acute rheumatic fever, it means that it's a multisystemic immunological disorder, which is basically a non-suppurative complication of group A streptococcal infection. And as it's a multisystemic, it involves skin, subcutaneous tissue, musculoskeletal system, that means migratory polyarthritis, CNS, Sydenham's chorea, St. Peter's dance, and it also involves the heart, causing carditis, inflammation of the heart, valvulitis, or any other pancreatitis. Actually, all layers of the heart would be involved. So that acute phase, the inflammation which is occurring in the heart layers, that is called rheumatic carditis. So rheumatic carditis is basically a manifestation of the acute rheumatic fever involving the cardiac system. And rheumatic heart disease, when we're using the term, basically that means some kind of permanent valvular damage which has already been done into the heart as a result of the preceding rheumatic fever. And usually rheumatic heart disease occurs 10 to 20 years before, after an episode of rheumatic fever. This is the typical. And that is one of the key causes of acquired valvular diseases in the world, rheumatic heart disease. So when we are using the term rheumatic heart disease or chronic rheumatic heart disease, that basically means it's a complication of a rheumatic fever. And rheumatic carditis is basically a manifestation of the rheumatic fever. That is the idea. And so these three things that you should not confuse. And actually, I was going through some responses or some messages today because I discussed about the rheumatic fever and the mitral valve involvement. And that's why I felt that there's a necessity to explain these three terms, that what is rheumatic fever, acute rheumatic fever, what is rheumatic carditis, and what is rheumatic heart disease or RHD or chronic RHD. I hope this helps to resolve your queries. Thank you very much for attending this 90-second session of the InstaLecture on rheumatic fever versus rheumatic carditis versus rheumatic heart disease. Thank you very much.